Bismillahirrahmanirrahim. Assalamu alaikum. Today in this short video I'm going to tell you how to use the Boolean operators. So there are three Boolean operators and you can see that these are and or not. Three and or not. When we try to use this Boolean operator and, it means that we are combining two terms or we are combining two concepts. For example, in this scenario you are looking at acupuncture and neck pain. So any articles that have acupuncture therapy along with neck pain will only be selected or will only be searched. While this is a restrictive term, that it restricts your results by this condition that any research must have in either their title or in their abstract acupuncture and neck pain. So you can take cervical manipulation and cervical spondylosis or multiple things, or let's say exercise therapy and weight loss. Now let's look at the Boolean operator or. This is basically used to combine some concepts or to broaden the search. For example, if we want to see all the researches on the neck pain or acupuncture, so they will be combined by using acupuncture therapy or neck pain. So all of the researches that have either the acupuncture or the neck pain, they will be considered. Lastly, we have this Boolean operator which is called as not, which is again a restrictive term. So if we want to focus on one thing, for example, we just want to look at acupuncture therapy and we don't want any neck pain or any other pain, so we will use it like this acupuncture therapy, not neck pain. So this is just the examples, and this is you can see very easy to understand from here, but let's try to practice this on the Pubmed. For example, we want to look for cerebral palsy. Last day I made a video on how to restrict your search. See, this is just the basic search. If we want to use any Boolean operator, when we are going to use the word or, this or, when we know the synonyms, for example, the cerebral palsy is also called as the Little's disease. If you see, previously our results were 3,700 something with the cerebral palsy, but now the results have been improved, that it has included a lot of other studies. So you can find, this is a mesh term, for example, cerebral palsy, medical subject headings, and you can find the synonyms of this term or any term, for example, mobilization or whatsoever, muscle energy techniques. So you can use or. It means that you are searching the same thing but with different names or with different synonyms. But when you want to use and cerebral palsy and, now it shows you physical therapy, physiotherapy, rehabilitation, or let's talk about cerebral palsy and balance, which is very common, and you can click search. Now you can see only 174 results are retrieved. So this is very easy to follow. Let's assume that we want to use not surgery. Cerebral palsy, not surgery. Here you can see 2,997 results. What if I want to exclude all those researchers who use physical therapy? So 3,100. So in these researches there is no use of physical therapy. So how we are going to combine these searches and what is the purpose for all of these? For example, if you want to write a systematic review or you want to search for the literature for any of your study or for your article, and you want to use these Boolean operators to refine your researches, to refine your results, then this can be done like this. For example, I told you cerebral palsy, and when you are going to use, or you are going to use synonyms, for example cerebral palsy or little disease or spastic cerebral palsy or this, and when you are going to combine this with your target, means that when you want to look for all the researches that include the cerebral palsy but they also include the balance or gait, for example, and gait, we can add gait. So we can also add another and, gait and balance. We can also add another and, for example function. So now I have used 1, 2, 3 and 4 different types of, you can say, variables, or 4 different types of medical subject headings to search. So now you will see only 52 results. So you have to define your criterias, you have to find your mesh terms first in order to utilize them, and it is always better to use your synonyms with or. For example, if I can add over here, or it's the little's disease, or let's call it as spastic cerebral palsy. Now I have used only the synonyms of the cerebral palsy. For example, if there is any synonym for the gait, you need to search it and add it. For the balance, if there is any synonym, and again for the function, if there is any synonym, you can search it. And now from the 52, let's see what is the difference. The result is still the same, but we are more sure that all those studies who have either represented or used the word Little's disease or spastic cerebral palsy for the term cerebral palsy have also been included. And now you can refine your searches or research. For example, from 2000, let's try to take it from the year 2000. I believe it's going to be 51 now. Let's take it to, let's remove the systematic review. This is from the yesterday search. So let's consider all the RCTs. So we are going to select the randomized control trial or the clinical trials as well. So here we are. Just the 56 results, and these 56 results, now you can send these to citation manager, all the results, and create file. Once you have created file, now I'll tell you in the same video how to import this file into EndNote. So let's try to see how we can do this. Okay, so I have opened the EndNote, and now I will show you how we can import all those references, these searches that we have exported. And this is the file. I moved it to the folder on my desktop naming the Pubmed. Here is the downloaded file, and let's try to import it. We are going to click onto the file, into the import, and click onto the file. And import options you have to select, because this is from the Pubmed, so we will select this Pubmed. You can select the Pedro or Cochrane or any other based on your search. So we are going to select this, choose, and then into the desktop we have this folder called as Pubmed, and here I'm going to click import. Now you can clearly see 56 over here. These are the 56 results. The good thing is that you can arrange these in the EndNote very easily. For example, this is yearly based classification or arrangement from 2001 to all the way 2022, and again this is based on the journals, and this is these are all the details like for the journal article and whatsoever, and the journal name.